Welcome back to Urgent Care Unscripted. I'm Barbara Renalter, Director of Operations and Business Development for AFC Urgent Care in West Haven.
And I am Muhammad Zaman. I'm the franchisee and owner of the AFC Urgent Care West Haven. Today we are here to talk about a topic that's important and at the same time sensitive. It's about confidentiality. What does it really mean by confidentiality? How do we protect your confidentiality, and how do we ensure that the services are discreet as and when needed? And why can you really trust us at AFC Urgent Care West Haven for your confidentiality needs? So that's our topic today, and I'll hand over again to Barbara.
Yeah, absolutely, Mohammed. It's definitely a topic that people think about a lot, but don't ever ask. And I think one of the things that we want to answer right here and right now is, yes, your visit at an urgent care is 100% confidential.
And what do we really mean by 100% confidential? It's that you have visited our clinic. That information cannot be shared with anyone, not your spouse, not your kids, not your employer, unless we have specific instruction or approval or consent from the patient to disclose the information. That stays with us.
Exactly. And that includes your test results, that includes your medical history, that includes your medications. So unless we have approval from you as the patient, we cannot disclose that information. It's something that we follow very strictly. It's part of the HIPAA law. It's a federal mandate. So we want to make sure that your health information is always private.
And the visit could be about many different things. It could be as simple as a sore throat. It could be a flu. It could be an STD situation. It could be pregnancy. Anything and everything, all information about your visit stays confidential because that is gold to us, and we do not share that information with anyone.
Yeah, absolutely. We even can be discreet regarding your billing. So if you don't want to go through your insurance because you don't want your insurance to know why you're here with us, we can definitely do a self-pay visit so that doesn't get disclosed to your insurance company. Obviously, those with Medicaid insurance, we cannot collect at the time of the visit. And so unless it's a Medicaid patient, we can definitely go that route if you feel more comfortable and you do not want any of your information to be disclosed to your insurance company.
Sure. And let's talk about why. Any patient, just like me as an owner, you could be my brother, you could be my children, you could be my parents, you could be a close friend. We respect and care for your privacy. At the same time, on the other hand, there are strict HIPAA laws that we must obey and follow when it comes to written communication, when it comes to talking to you over the phone, when it comes to seeing you and giving you advice, when it comes to a follow-up call. Every single piece of information has to be protected for your sake, for your safety, and for your privacy.
Yeah, one of the big things I think happens at an urgent care, and I'm sure happens at every other office as well, is we get phone calls from partners and parents wanting to know if my child was seen or if my spouse was seen and what their lab results were or whatever that may be. And we have to make sure, first and foremost, that there is written consent from the patient for us to disclose information. And when we don't have that, we do have to inform that person that unfortunately we cannot speak with you regarding that patient or any patient because we don't have approval from the individual. So I know it can be frustrating for the spouses at times and the parents, but it's something that we do to protect your loved ones like we would for you as well.
And on the flip side of needing the consent and the requirement of consent is also the situation where, by the law of Connecticut, anyone at the age of 13 or above does not need parental consent to visit an urgent care, to get treated for their situation. They are not required also to disclose to their parents what they came in to be treated for. So the comment here and the advice here is that if you're in a situation where you need treatment, your health is the priority for you and as well as for the clinic, and you are protected from being used, that information being used in a harmful way for you.
Yeah, I just want to just mention on something Mohammed touched based on. So in Connecticut, at the age of 13, patients can, it's not every single service that is protected under that law. So it's only for STD testing, mental health, and birth control. So all other visits do have to be disclosed to the parent. But if they are coming in for those reasons, and I'm not sure if there's any other services, but those do not require parental permission.
Yeah, we never make any assumptions. We provide honest and compassionate care and the privacy to make the choices that are right for you.
Absolutely. We take that very seriously. We want to make sure that you guys are safe. We want to make sure that we are responsible with your healthcare decisions. And we also want to know that we want you to know that we are taking care of that information and keeping it as discreet as we can.
So just to summarize, we take your privacy very seriously. We do not disclose unless there is consent. There are some situations like Barbara mentioned about STD testing and mental anxiety and other situations where if you're above 13 and above, you can come and get treated and still maintain your privacy. But above all, we follow the rules, and HIPAA laws strictly govern in every urgent care situation, including us. So please feel safe as you come and visit us and share your information and get treated for your situations.
Yeah, one thing I do want to mention is when you come in to the urgent care for employment reasons. So if your employee or your employer is coming to us, sending you to see us for a drug test, for a physical exam, for an injury, we do have to disclose any information that is strictly related to your employment. But when it comes to your medications, we don't have to give that to your employee. When it comes to any mental illness or medical history, we do not have to disclose that unless it relates to your job and your employment. So just keep in mind when it comes to being sent over to the clinic for employment reasons.
And Barbara, if you can expand on how do we protect the confidentiality? What do we do in terms of papers? What do we do in terms of electronic communication? What do we do in terms of phone communication to prevent their confidentiality?
So all of our communication is secured. Our email is secured. Our online check-in process is 100% secured and HIPAA compliant. So we do a really great job when it comes to that. Even the paperwork that we do, we try to minimize paper as much as we can because I feel like that's the most room for error is when it comes to paperwork. So what we do with the papers, right, as soon as we're done scanning into your chart, into your electronic medical records, is we put it in the shred and it gets picked up and it gets shredded and it's no longer exists. But we do a great job with that. But otherwise, everything that is done electronically is HIPAA compliant and is secure. So you can sleep knowing that all of your information is safe.
We want our patients to feel safe and secure when you consider visiting us, and we have tried to summarize everything and anything that's about confidentiality, the rules, and how we follow the rules and how we exercise the rules. Please visit us at AFC Urgent Care West Haven, and we look forward to seeing you again for our next episode on Urgent Care Unscripted. This is Muhammad, and with me my co-host Barbara.
Yep, and I'm Barbara Ronalter. We are at 354 Sawmill Road in West Haven. Come see us anytime you need us. Thank you very much.
Thank you.